why. Okay, I've accepted you, Nina. This is me. Thank you, ladies. Thank you for joining me this evening. I'm grateful for you to come and yourself. Nina, you want to go first? Tell us who you are and what you do.
Hello, ladies. Thank you for having me. So my name's Nina Lemtir, and I'm a nutrition lifestyle strategist. I found myself in this space because I had to help myself have my children. In a nutshell, I was told I would be lucky if I would have one child. I was told my fibroids would grow back, and to cut a long story short, I've been shrinking my fibroids over the last 8-10 years, and I've never felt better, particularly compared to my 20s. And I now kind of share resources. I empower women to just give them hope and alternatives to repetitive surgery, and strong, medication that obviously comes with various side effects, particularly if they're wanting to conceive. A lot of the strong medication kind of goes against that kind of goal. So really just equipping women with not just the information, but also the tools. So actively helping them with their nutrition, supplements, and lifestyle adjustments. So I've been doing that for now about 8 years.
Amazing. Amazing and well done. I see you. I see you. Thank you. Thank you. Thank you. Dr. Angela, well, I already said who you are, but please introduce yourself and tell us what you do.
Okay. Hello, everyone. I'm Dr. Angela Esiwe. I'm a GP. Before becoming a GP, I worked as an obstetrician and gynecologist for 10 years. So I've been a GP now for about 7 years. So obviously I've had an interest in women's health, and I'm happy to be here. I'm looking forward to seeing how it goes. Thank you.
Thank you. Thank you both. I'm grateful for you both tonight to joining us in this conversation. And we're just going to get into it. We've lost a lot of time already. So Dr. Angela, help us to understand what fibroids are and how does this relate with fertility, and also because it's cervical screening week, how does that also overlap with cervical screening? Okay.
Well, fibroids, they're quite common, especially in black women, and followed by Asians, but white women can also get it. And they're actually benign growths that we find in the womb, muscle of the womb. So when I say benign, that means it isn't cancer, but it grows within the muscle wall, and within the womb, and it can grow at different parts of the womb. Now, how does it relate to fertility? Now, the one thing I want to say is, if you do have a fibroid, you shouldn't panic, because fibers can vary with size, the numbers, how it affects the cavity of the womb.
That's right.
But in some cases, it can affect fertility. So I'm talking about in the cases where it affects fertility, it affects it in two ways. Either you may have problems conceiving, or when you conceive, you may have problems with maintaining the pregnancy. And often that would result in something we call miscarriage. But to put a positive light on it, yes, some people go through difficult times with it. However, they are treatments that are there.
That's right.
Now, cervical screening is an important topic to discuss, because it's a screening program that we have in the UK, and it's free for everyone from the age of 25 to 65. So I'm glad that you're talking about it today, because it's important for people to go and attend the cervical screening. But how does it relate to fibroids? In actual fact, there's no direct link between fibroids and cervical screening. So don't worry, if you have a fibroid, you're okay to attend for a screening. But having said that, sometimes you can have problems with your fibroid, and that might make you anxious to go for screening. But it shouldn't affect the result of your screening test.
Amazing. Thank you. Thank you for that. I mean, just for me is also, for me it's important to highlight these things. Sometimes women, have all of this many things going on, and we
Yeah,
wonder if one is affecting the other. So
yeah,
thank you for highlighting that there's no direct link, but also
yeah,
it is important to have your cervical screening done.
yeah.
Thank you for that. So Nina, I'm going to come to you. What are some of the lived experiences you often hear women dealing with, in your journey and in the community that you work with?
Pertaining to cervical screening or fibroids or both?
So what have you experienced? So mostly, of course, fibroids is major topic, but around, because I'm also aware of I'm trying to create awareness and also get women to be aware around cervical screening and how that's also important. Being also, if it is cervical screening week, just creating awareness for that alongside while we're talking about fibroids and all of the work you're doing in that space.
Right, yes, absolutely. So I personally actually got to, I believe it was stage 3 of the screening process because I had abnormal cells detected,
Mm-hmm.
unfortunately. And that was before I got diagnosed with the fibroids. And I actually was on another day talking about this, and I went through a very stressful period before the cervical screening. And I really believe that that contributed to, I don't know, the stress, it just contributed to those results. And I prayed about it. It was such a stressful time. And when we got to, I think it was the last referral stage, and I think it was going to get escalated, my results just came back normal. The cells had just normalized. And I've been obviously going back for the checks, and it's so important for women to make time and not overlook, because you just don't know when or what could cause abnormal cells to be detected. In my case, other than immense stress that had taken place from a few years before it, I don't know what could really contribute to it. Maybe Dr. Angela could shed some light on possible variables that might be.
Yeah, absolutely. And I was going to get to that because honestly, tobacco screening can be really painful. I'll talk about from my own personal
Yeah.
experience because I've not had natural birth. I've had both of my children cesarean. So every time I try to go for the screening, and it's excruciatingly painful, I'm like, why is this thing painful? And so and for that reason, honestly, I used to just have I have nightmares even thinking when the next one is going to come, and then when I get my letter, I'm like, oh God, do I want to go for this thing? This is painful. So I want you to kind of highlight or touch what should people expect, what should people know about, especially when they're going for this screening, and how can we help prepare women, when they're going for this screening, and what can be done to make it bearable for women.
Nina, I'm sorry to hear the experience you went through, and also Toyin as well.
Thank you.
But yes, I'm going to sort of try and break it down to help people that have had bad experiences with it, and also for those, there may be young people within the live chats that haven't had a smear test before, because it starts from the age of 25. Generally, I'll summarize what happens. It's every 3 years up until the age of 50, then every 5 years. But in cases where if it's picked up that you have an abnormal result, you might need it more frequently, as in the case of Nina. But yeah, how can we what happens when you come for a smear test is most often done by a nurse, but sometimes it may be done by a doctor. It depends on the setup of your GP surgery. I'm talking about in the UK setting, because in other countries it's done in a different way.
Yeah.
And it's an assessment where we have to find the cervix, and we do that with a plastic instrument called a speculum. Now, things have changed, because in the past there used to be metal speculums, and that used to be
I remember
really,
those.
really, really, really painful, really, really cold. But now they're they're plastic ones. And I think the way we can make the experience better is, I think as GPs or a nurse who's taking the test, is taking a history from the patient, because obviously if the patient isn't heard, then they will feel anxious. Providing a supportive environment. So I tend to recommend, if you've had a previous bad experience, or you're suffering from pain or dryness down below, perhaps come with a chaperone, come with a relative or a close friend. We also provide chaperones in the GP surgeries, so someone to hold your hand, and then as a clinician, the choice of speculum is really important. The position you lie is very important.
Right.
So you can be given options. In most GP surgeries, we tell you to lie down, but in some surgeries, if for instance you have a surgery that fits coils in, your legs can be put in stirrups. It's not an ideal position, but it just helps.
Okay.
And sometimes why it's dry, anxiety in itself can make it dry. And that's the problem. Once you've had a bad experience, so it's about trying to make the person as relaxed as possible. So often I would have, if it's someone that's having his first smear test or has been anxious, I would actually recommend a chaperone to hold your hand, to talk to
Right.
you, to help you relax. And that helps relax the muscles down below, and talking through the process. And I always sort of say, if it's painful, I'm happy to stop. Now, sometimes it's maybe dry down there for whatever reason. It's very common in perimenopausal, and in Black women, it actually starts quite early.
Right.
Most
Right.
people feel you go through the change in your mid-40s or 50s. For Black women, it can happen sooner. If you're post-pregnancy, it can happen sooner because the estrogen level is low. So
So.
if that's the case, you can actually have treatment beforehand, 6 weeks estrogen treatment if it's safe, and then you come back for your smear test.
Okay.
Yeah. So I
Please.
mean, and what I would say, I mean, Toyin, because I remember I recollect you saying each time you get your letter, you're
Oh, I'm
scared.
traumatized. Yeah.
Yeah, you're traumatized, and that is completely understandable.
Mm.
Maybe you might share, how do you go past that then?
I, to be honest, I just go and bear the pain, but which is not right.
Mm,
I just turn up already anxious, traumatized
mm,
from the last
mm,
experience,
mm.
and
Hello, you've cut out.
Yeah, I think her connection is not so stable.
Oh, bless her.
Yeah.
But
Are
Nina,
you
you
in?
can hear me.
Yes, I can hear you. You're in the
Yeah,
UK, right? You're in
yeah,
the UK.
yeah, yeah. So I mean, what I mean, whilst Tony is trying to get in, I mean, in that situation, I would say we do have to speak up. We have to empower ourselves if we're feeling like that.
Yeah.
Um, you can actually request for a double appointment. So that gives the clinician more time to do the examination and actually
Right.
perhaps to talk to you beforehand.
Right.
Um, yeah, because yeah, it's well, it almost breaks my heart to hear that this is Toyin saying that each time she gets her letter, she worries. I mean,
Mhm.
each time I get my letter, I worry because just of the thought it's a sensitive examination.
Yes.
Women, we go through having our breast checks, our cervical smear check. We go through pregnancy, or if we go through miscarriages. So everything is quite sensitive.
Yes.
But one other thing I thought to say is that if you suffer from pelvic, I think Nina, if you can say what I had said, because that would be, it would be nice to hear it from your side, your point of view.
Right. So, um, you mentioned that a woman can, if she's
Yeah,
perimenopausal, can go on like an estrogen prep, like 6 weeks before their appointment to just
yeah,
support kind of moisture levels
yes,
down there, so it's a bit more comfortable, the procedure. You mentioned that a aid can be provided by the surgery, the NHS on the day to just give moral support, or should I continue?
Is she there, Dr.
Toyin, should I
Angela?
continue?
I know she also said about the chaperone. I didn't even know you could go with a chaperone to go
Yes, you
to
can
your
go with the
appointment.
chaperone. Yeah, and there was another really good, and I thought, wow.
It was estrogen and the chaperone that
Yeah.
Dr. Angela,
Yeah,
are you
this
there?
was
Can
another
you hear
one.
us?
But yes, you can ask to go with a chaperone. You can ask for a double appointment.
That's it.
Yes, they might not be able to give you on the day of the appointment, but that can be arranged because I think
Okay.
it would just give time for them to explore what your concerns are. Even if the first consultation you're not able to do it, then a follow-up appointment can be made. So it's sort of a second stage. Now, the next point I was going to come across, if you do suffer from pelvic pain, it's a good idea to take your painkillers beforehand.
Okay.
Yeah. And then if you're worried about estrogen, although I can tell you local estrogen has no, there's no link between it and things like breast cancer and so on, because only hardly anything goes into the system. But if you wanted to try non-hormonal treatments, that's fine, like silk, which is a natural product made of kiwi extracts. That's one of the examples of many. Yeah.
Silk, did you say? You see, I mean,
Yeah.
thank you for pointing that out because
Yeah.
honestly, that's for me is education, knowing that the local estrogen is
Yeah.
not going to affect much because I've always had in my head like, oh, those I just don't want any of those things. But
Yeah.
thank you for highlighting that honestly. And
Yeah.
what did you call it? Silk is a better one, did you say?
Well, it's a non-hormonal one. Silk
Silk.
is non-hormonal. If you didn't want any estrogen at all, that's an option.
Amazing. Amazing.
Yeah.
Thank you for sharing that. That's really awesome. Awesome. Okay. I know we haven't got much time, but is there anything that you will want to add to it, Nina, from your work with women? What have you experienced women? I know you shared your experience. What have you experienced women come to you or in conversation around cervical screening, or even how, as it relates to the fibroid work that you're doing, what have women come to you with that can be useful for other women today to glean from?
One common kind of, I suppose, report is when they're going through the process of meeting their gynecologist and being recommended a course of treatment, they're not the side effects of the drugs are not being clearly explained, and women are going in quite blindly of what the drug is meant to do and then what the side effects, like what actually happens and what they go through. Specifically about, I think it's Ryco. Ryco is the one
Yeah.
that's quite common, and there's another one, and they're told that it's going to shrink the fibroid, and that's like the main reason why they're like agreeing to take it. But then from what I've heard and the research I've done, Ryco is more about addressing the hormonal, basically just switching off the hormones so that estrogen is not being produced. So it's more about the symptoms, but not actually the fibroids. So I don't know how you feel about that, Dr. Angela, or how this could happen in regards to the patients not being really clear on the
Yeah.
symptoms and the
I
purpose
mean,
of
at the moment, RICO is secondary care initiated, so that has to be done by the gynecologist. It doesn't come from primary care,
Right.
and it's not been around. It's been around for long in other countries, but it started off as a treatment for endometriosis first, and now it's licensed by NICE for fibroids. I
Okay.
mean, NICE is the clinical excellent board of guidelines that gives reference, and for most treatments, you need to persevere for 3 months. I am actually also I'm suffering with fibroids at the moment. My fibroid, and I don't mind sharing it as a patient. My
Thank
fibroid
you.
is 20 weeks size. And I've had it I've been battling with it for 5 years. And initially I had the Marina and that worked wonders.
Right.
But then after 3 years, it stopped working.
So when you say
And
worked wonders, what did it do for you? What was
well,
the
the
benefit that
heavy
you got?
bleeding, I became anemic and I had really heavy, prolonged bleeding. So
Mm-hmm.
it made my periods much lighter and shorter. So I was instead of
Right.
having it every 3 weeks for 14 days and clotting, it reduced it to about 3 to 5 days. But then all of a sudden it came back. Well, originally actually was every month. And then when it came back every 3 weeks.
Mm.
So I've tried Zolidex injection, and the last thing I was told was because I'm getting towards the menopause age, your fibroid will shrink, and that's physiologically that's what makes sense because they say estrogen feeds fibroids. So if you're going through the change, it should
Mm-hmm.
shrink. But in my case, mine hasn't, and
Okay.
the way Reiko works because it's got I think 2 or 3 hormones in it. It's like Nina said, it reduces the estrogen level.
Mm.
So in effect, it's meant to help shrink the fibroids, but I'm not aware of how effective that is. Um, a few patients in my surgery have it. Some have had good experiences, some haven't, but they have to persevere for the 3 months. But that information ideally should come from secondary care. When I was offered it in the hospital, they were going to give me information leaflets, but I didn't opt for it because I was tired of taking tablets because I had to take desogestrel pill on top of my Mirena. So
Uh,
I've gone for uterine artery embolization. So I had my MRI scan on Monday and I'm waiting
okay.
for the result of that. And for uterine artery embolization, it's a procedure, but not as major as having a hysterectomy.
Mm-hmm.
And what I was quoted is that it will shrink my fibroid by 50%. I was given an information leaflet,
Right.
um, and they said you ideally have 1 to 2 weeks off. But yes, I must say, in my mind, I'm thinking, what's going to happen whilst it's shrinking? And I presume I might get pain, I might get irregular bleeding, but I'm willing to see it through. I think,
Sure.
Nina, you're right. You need to be given enough information so that when you get side effects, you can cope. Yes, it might not be great, but you might be able to cope with it better. Because if they say, well, we assume it's going to work quickly, then it
Mm-hmm.
can be quite disappointing. Whilst if you're
Mm.
told, well, give it time,
It's
it might
time.
take six
Mm.
weeks, it might take 3 months, that might help.
Yeah.
Mm.
Yeah.
Yeah.
Thank
Absolutely.
you, for that, Dr. Angela. I mean, that's thank you for sharing your personal journey and story as well. That's useful to know, and honestly, it's about, and this is where advocacy comes in. Because
Mm.
when women get offered things that don't fully have the whole picture, and then when something's happening, like, oh, is this supposed to happen, or am I, and so it's useful, and that's not why joining communities, making sure that you're speaking up, you're reaching out to your primary care, secondary care carer, just making sure that you're getting the right information, the right help, for whatever it is that you're going through during your treatment and your journey, regarding feminine health issues. Thank you for that. And with your embolization that you just done, you have done that. Is that what you
No, I
said?
haven't done it. I've just had my MRI scan, so I'm
Okay.
waiting. Yeah.
Okay. I wish you all the best with that, and
Thank you.
Yeah.
Thank you.
quick recovery as well. When
Yeah.
you do have that. Yeah. Thank you. Amazing. Amazing. And one other question that I wanted to ask. Um, can your can fibroids, when you have fibroids, can that affect the accuracy of smear test? Do you think?
It shouldn't do. No. It is,
Mm.
as far as I'm aware, it shouldn't. It shouldn't do.
Mm.
Um,
Okay.
because we're looking at the neck of the womb, and the area we're looking at is called well, in medical terms, squamous columnar junction. Fibroids, having a fibroid shouldn't affect your smear test
Okay. Okay.
test
All right.
result. Yeah.
Okay.
I mean, what is, Nina, you did ask a question about, because in your case you said stress could have caused it. What are the other causes for abnormal smear test? What they do now in the UK is they actually test it for HPV virus.
Right.
So it is linked to abnormalities can be linked to HPV infection, and this is a virus, and often most of us may have some form of HPV infection because being sexually active, you can get it, and there's so many types. The one linked to cervical cancer is that there are two main types, type 6 and type 8. But what happens with when you have abnormal smear test, it doesn't necessarily mean you are going to get cancer. That's why it's a screening. But it may be that you're at risk. That's why you have further testing. And sometimes it does resolve. But yes, I mean, we don't know what stress does. Stress can affect us in so many ways.
True.
But yeah, HPV infection is the one thing that can affect smear tests. Yeah.
Right.
Okay.
Right.
Thank
Yeah,
you.
I would have that. Thank you. Thanks for clarifying.
Oh, amazing, amazing. Oh, thank you so much. Thank you for this really powerful and honest conversation that we've had tonight, even though brief, due to all the technical issues that we've had. Well, thank you, ladies, for joining me today. What two takeaways or messages would you want to leave with women today before we round up? If you want to go first, Dr. Angela and then Nina.
Well, I think what I would say is that I think we as women, we have to empower ourselves. So if you've got any concerns at all, if you don't feel comfortable with one health professional, get a second opinion. I know it is
Absolutely.
hard when you're under a specialist in secondary care, but then you can come to your GP. We may not have all the answers, but if there's someone there with an interest in women's health, hopefully they will be able to help you as much as they can. They are very good websites. There's the British Fibroid Trust UK website. There's information that you share. So empower yourself by reading about it, attending these things. Cervical screening is important. It saves life. It picks up actually 7 in 10 cases of cervical cancer. So so please attend if you can. When you get your letter through the post, it's not only the GP surgeries can do it. You can go to a sexual health clinic to have it done if you wanted to, but it has to be within the 3-year or 5-yearly invites.
Okay.
But no, I just wanted to end by saying, Toyin, thank you for inviting me, and
Oh,
Nina, thank you for sharing your experience. I think a lot of women now are very much keen on the nutritional side of things, especially with estrogen feeding fibers and so on. So I wish there was more time for me to ask you questions, but maybe that will
We're
be
gonna do
another
this
talk.
again because
Yeah,
we were cheating out of time, so we're gonna come back
yeah,
honestly
yeah,
and have this and get to focus more on Nina's holistic and
yeah,
nutritional side of wellness for women,
yeah,
with fibroid and womb care issues and feminine health
yeah.
issues, honestly. So definitely we'll come back. Thank you, Dr. Angela, for coming. So Nina, what would you say to women before we round up for tonight and have a second part of this?
Yeah, sure. I would say definitely with any course of treatment, once you've kind of gone through to, like Dr. Angela said, the secondary care, you've reached that stage and you're in a course of treatment, explore holistic processes that will enhance and complement, whatever you're doing. Obviously, get things checked out if you need to in regards to supplements and things. But that's what I would definitely emphasize, for the embolization, there's things that you can do just to support pre going for the procedure,
Prepare you.
Okay.
that procedure, because there is a level of, it's invasive as well. And you just
Yeah,
want to optimize the process and get longevity out of it, because I've spoken to quite a few women that felt like there was a level of change, but it kind of fizzled out over the years, or their symptoms kind of just came back slowly. So I don't know what the success rate is and how it all works, but I think there's things you can do just to support the results and just to get the most out of whatever medical treatment you're having.
Yeah.
Thank you. Thank you.
And mostly it's about, like Nina said, preparing your body. It's also for the healing journey, isn't it? Because honestly, everyone's different. Your healing process is different, but it's helpful when you've prepared your body, especially for the healing. I mean, I had embolization, but it wasn't even for fibroid, for something else. But I just assumed, because he was not cutting through me, it was going to be easy. Healing wasn't that easy. So I think it would be useful to prepare your body for the healing journey and all of that. I mean, we can talk outside of this, Dr. Angela, and I can sample to one or two people who I know I've worked with that can help as well. And if there's anything that you can help Dr. Angela with, Nina, that would be useful, please.
Yeah.
Let's connect, and this is what this is all about: helping each other on this journey and making sure that we're doing it right and we're living well, and somebody's leveraging on the other person's journey to do it
thank
differently
you so much.
and do it right.
Thank you for inviting me. It's a pleasure to share the panel with you, Dr. Angela. Thanks for all your really valuable information.
Thank you both. You see, everyone wants both of you to come back. They say to come back, so we're gonna have
I'm
this
happy
again.
to come back. I'm happy to come back. I had technical issues as well. I've never done a live chat on Instagram. But yeah, I kept joining as one of the audience. But hopefully next time it will be better on all areas.
Definitely. You've learned, so that's it. Thank you for trying. Thank you so much for coming. I appreciate you both. I'm grateful. And thank you for the patience and all the technical things that I had going on today.
That's okay.
Thank you for sharing, ladies. We will come back. See you soon. Have a lovely evening.
Thank you. Bye-bye, everyone.
Good night. God bless you. Good night. Good night.
Bye-bye.
Bye-bye. Bye.
Bye.